Hi, I am so delighted to meet you in the program of 1 minute please. What is Icosapent ethyl? What is the mechanism of action? What are the indications for Icosapent ethyl and what are the adverse effects? Let us see. Icosapent ethyl is nothing but it is a purified form of icosapentenoic acid. You are all aware that we require omega-3 fatty acids because our body cannot synthesize these omega-3 fatty acids because omega-3 fatty acids play a major role in cell membrane structure and cardiovascular health and brain and retina function. The omega-3 fatty acids are three types. One, alpha linoleic acid and icosapentenoic acid are otherwise called EPA and docosahexaenoic acid are otherwise called DHA. Alpha linoleic acid mainly present in the plants. On the other hand, EPA is present in the fish and DHA present in the fish and as well as algae. So, if you consume only plants, this alpha ALA will be introduced in our body, then this ALA should be converted into EPA and DHA. What is the most important is this EPA and DHA if you take directly, then the beneficial would be much immense because the conversion of ALA to EPA and DHA is much limited in our body. When you consume fish oil, which is a OTC product containing EPA and DHA, what happens? These omega-3 fatty acids are capable of reducing triglyceride, but DHA can elevate your LDL. So, when you consume fish oil for the sake of increased level of omega-3 fatty acids in our body, it can elevate your LDL because the OTC product fish oil contains both ALA and DHA, but ALA can reduce your triglyceride, but DHA not only reduces triglyceride level, it can increase your LDL. That's the reason they separated icosapentenoic acid and it is purified and it becomes higher graded prescribed molecule as icosapent ethyl. How it gains much clinical attention? When icosapent ethyl is produced to reduce the triglyceride level, REDUCE-IT trial clearly demonstrated that it not only reduces triglyceride level, it is capable of reducing cardiovascular event in a patient who is on maximally tolerated statin with either atherosclerotic cardiovascular disease or diabetes mellitus with 2 or more risk factors. What I try to say, the main indications for icosapent ethyl is not only reduction of triglyceride level, it can reduce your cardiovascular event as well. On the other hand, fenofibrate we commonly use for reduction of triglyceride is not able to reduce cardiovascular event. That is clearly demonstrated by field study which failed to prove that fibrates are capable of producing significant reduction of cardiovascular event. In that way, icosapent ethyl not only reduces triglyceride level, it is able to reduce cardiovascular event. So, what are the indications? When someone presents with triglyceride level more than 500, say 1500, you can introduce icosapent ethyl capsule 2 gram twice daily to reduce the onset of acute pancreatitis. The main purpose of treating hypertriglyceridemia when someone presents with more than 500 is nothing but to avoid the incidence of acute pancreatitis. But when someone presents with triglyceride level, say between 150 to 499, say 436, 400, where the main purpose of treating lipid profile is not to reduce triglyceride level, your primary target should be the LDL. When someone presents with LDL level of 113, a known case of diabetic or a known case of atherosclerotic cardiovascular disease who harbors triglyceride level 400, then you should not be tempted with the high level of triglyceride level rather than treating LDL level. So, any patient who presents with lipid abnormalities, your main primary target would be treating LDL to avert the cardiovascular event. So, any diabetic patient with more than 2 risk factors or anyone has history of established atherosclerotic cardiovascular disease, say stroke or MI peripheral vascular disease, where your main aim is to reach the LDL target. For example, if someone harbors atherosclerotic cardiovascular disease, their LDL target would be 50. According to Lipid Association of India, anyone who presents with history of atherosclerotic cardiovascular disease, your main target would be LDL. The LDL should be maintained below 50 milligram. So, these patients first deserve statins to bring down LDL. You ensure that the LDL is brought down below the target value. Repeat lipid profile after 4 weeks. Despite introduction of maximal amount of statin, your LDL level is reached, but still triglyceride level more than 150, then probably you can bring in Icosapent Ethyl to treat the residual cardiovascular risk. Once again, I would like to emphasize that any patient who presents with hypertriglyceridemia, first look at LDL, and based upon the risk groups, you fix up the target the LDL level, you bring down the LDL level to reach the LDL target. For example, if someone has atherosclerotic cardiovascular disease, LDL level will be below 50. Any diabetes patient with one end organ damage, the target would be LDL level would be less than 50. So, first you have to meet the LDL target by escalating the statins and repeat lipid profile. Now, make sure that whether you have reached LDL below 50, you are not able to reach LDL below 50 despite introduction of maximum amount of statin, then you can add ezetimibe or bempedoic acid. In the worst case, still you are not able to bring down, then probably you can introduce PCSK9 inhibitors. So, first target LDL. Please remember that statins are capable of reducing triglyceride by 15 to 30%. So, we do not need to think that statins are not capable of reducing triglyceride. So, you have to add fibrates or Icosapent Ethyl in a hurry. So, treat LDL as the primary target and treat non-LDL as the co-primary target. Then you come into address the triglyceride. So, still your triglyceride levels on the higher side after reaching LDL target, rather than introducing fibrates which are not able to demonstrate any reduction of cardiovascular event as evidenced by field study, then you can introduce Icosapent Ethyl 2 gram twice daily. Now, what are the mechanisms of action? Icosapent Ethyl inhibits the pathway of triglyceride synthesis. The main important final step and the committed step of triglyceride synthesis is the conversion of diacylglycerol into triacylglycerol, otherwise called TAG. Triacylglycerol is otherwise called TAG, that is the original triglyceride or storage form of the fat. So, this conversion of diacylglycerol into triacylglycerol or otherwise called triglyceride is inhibited by Icosapent Ethyl. But reduced IT trial clearly proved that Icosapent Ethyl extends benefits beyond what would have been done by triglyceride reduction alone. So, it has some pleiotropic effects. So, what are the pleiotropic effects of Icosapent ethyl? When you administer Icosapent ethyl, it not only reduces triglyceride production, resulting in decreased VLDL production, it is incorporated in the cell membrane. So, when Icosapent ethyl is incorporated in our cell membrane, it competes with arachidonic acid. So, what is the beneficial effect when it competes with arachidonic acid? Arachidonic acid, when it is converted into prostaglandins and leukotriene B4, that elicits much inflammatory action or inflammatory cascade. So, when Icosapent ethyl competes with arachidonic acid, when Icosapent ethyl is converted into less inflammatory mediator like PGE3 and leukotriene B5, there is the reduction of inflammatory cascade. 1. It improves endothelial function, it reduces platelet aggregation, it stabilizes the atherosclerotic plaque. Because of all these actions, it is capable of reducing cardiovascular events as high as 25% as compared to placebo. So, when I say so many merits about EPA, so what are the disadvantages of Icosapent ethyl? Generally, after introduction of Icosapent ethyl, patient may complain of muscle pain and joint pain, and there may be 1 out of 100 patients treated with Icosapent ethyl may develop gout. So, probably if patient has past history of gout and they have increased level of uric acid, then probably no, you have to weigh the potential benefit and risk ratio. And second one, the most important serious adverse effect but lesser incidence would be atrial fibrillation. They say that since Icosapent ethyl is incorporated in each and every cell, when it is incorporated in cardiac myocyte, it alters the receptor signaling and ion channel, resulting in there may be lesser incidence of atrial fibrillation. Those who have past history of atrial fibrillation, then you must exercise caution. And second one, there may be chances of bleeding risk. So, those who are on anticoagulant and those who are on antiplatelet, then probably you have to weigh the risk and benefit ratio. Take home message: Icosapent ethyl is a purified form of eicosapentaenoic acid. It not only reduces triglyceride level, it is able to reduce cardiovascular event. So, when you make attempts to reduce cardiovascular event in a patient with hypertriglyceridemia, with the history of atherosclerotic cardiovascular disease, with diabetes, with more atherosclerotic cardiovascular risk factors, then introduce Icosapent ethyl 2 grams twice daily, and beware of bleeding risk and atrial fibrillation. Thank you.